Okay, great. Well, I'm here today with Dr. Ryan Smart. And Dr. Smart, if you could tell us a little bit about yourself, your practice, where you're located, what you do, that sort of thing would be great.
Well, I've been practicing chiropractor since 2006. I graduated from chiropractic school at Life West. Um, Learned a variety of different techniques throughout the years, treating mostly spinal complaints there, structural things like scoliosis. But I was always frustrated when it came to like organic issues with the patients and didn't really have any tools in my toolbox. And once I found NIS, it was like this ability to work on a whole slew of issues that I never were before. And what I found is that when I'd work on the other issues, people wouldn't need the adjustments anymore.
Yeah.
The NIS has really transformed my life, my wife's life, my kids, and how I practice to more of how do we make this body as healthy as humanly possible, as fast as humanly possible. And I've met up with a couple other doctors recently talking about the neurologic integration system. And what I'm finding is that people are trying to find this stuff. His patients have been telling him to try it out here, but what he's not able to do is he's not able to access the brain to get the results in a faster capacity. And I'm realizing now how amazing it is to be able to zone in, basically like make the brain aware of an issue, and the brain kicks in immediately, changes happen, and it's non-violent, it's non-invasive by any way, shape, or form, but people just change getting off of the table.
Yeah. Say a little bit about, because I'm interested in what it was like for you transitioning your practice over from a kind of a standard chiropractic model to the NIS. How was that for you?
Well, it's difficult because as a doctor, you want to help people. And when you know you can help people more with something that they're not technically knowing that you have, A, and B, you don't know how you're going to charge for it, it's really easy to give everything away. And I started doing that. Started like just working on people for no additional charge. And the results were so phenomenal. What I realized also that I was kind of piecemealing it. So I started setting up at the beginning hour-long appointments with people, and I'd go through all of Part A and Part B and check everything with people. And I got even better results when we went through everything. And so I knew I needed to make it a separate visit. So that's what I really did, is I made it a separate visit. It's not part of my chiropractic treatment. We don't do any like piecemeal, that kind of thing. If a patient needs it, you set up, you sign up, and we're in the process of transitioning more and more to almost all NIS here, I think, within the next 12 months.
What percentage of your practice would you say is NIS right now?
It's in the 30%, 40% range.
Yeah.
And I'm transitioning more that way. The hard part for me at the beginning is getting them just to understand why to do it. But everybody who does it wants more.
Yeah.
Look that way.
Now, they'll never want to go back, right?
Yeah, that's it. I think that's the hard part for me, is that the patients almost go, hey, I know you like chiropractic, and I maybe occasionally something, but probably just do this to me.
Yeah.
More what I'm getting.
Tell me a little bit more about, was your practice cash-based or insurance-based before you learned NIS?
It was probably about 60% insurance.
And now I imagine is the NIS helping you make more of a transition to a cash-based practice?
Yes, very much so. We've already calculated out, I think, to make the same amount of money as was with chiropractic, I need to see about 8 people a day, which means I could spend more time with people and give them a little bit more care.
That's great. How has this affected your confidence, clinical confidence, in addressing difficult cases?
Well, that's pretty unbelievable there. it's hard to believe. I don't know if I would have believed when I first started that I would be where I'm at now, in that someone comes in with an autoimmune issue or a severe digestive gut issue. I'm completely confident that we can make positive changes in the body every visit now. And we can show people that their body's changing almost instantaneously. Today I had a lady, and she darn near couldn't hold her glutes with almost any strength before the treatment. And after the treatment, muscles just locked like normal, like just solid. And it was easier for her to get up and walk, even though we were working on things like the large intestine and gallbladder that she was having issues with. The best part for me is that I don't have to assume I know enough to treat the body. I can rely on NIS and the patient's brain, to tell me what I need to work on, what I need to help that patient get the results. And half the time it's what I think it is, and at least half the time it's not. It's somewhere just obscure, but the results are always there. You just maybe not how you think you should get there. You know, in chiropractic school, everyone said you got to adjust C2 for headaches or something. Well, with NIS, you realize it might be an ingrown toenail or something weird. But the fact is that I don't have to try to guess. That's what a lot of it is trial and error with all people. Is let's try this for a while. If that doesn't work, then we try this for a while.
Yeah.
With NIS, it's like digging through all the BS to get to what's causing this problem. Why is it not going away? And what do we need to support that for the future? And instantaneous results. I mean, every single person in the last 3 weeks or so gets up off the table and almost feels lightheaded, dizzy. And I tell everyone, you got to get up slow. I worked on osteopath a couple weekends ago. It'd be interesting to see how she did there, but she got worked on, and you could see on her face, she's like, okay, you did something to me. She stands up like she normally would, and she has to hold on to the table, and her face goes flushed. And she's like, what did you do to me? And but they feel that something's different, and you can show them that their body's changing. And with NIS, you can go deeper into showing them all the different organs and body parts that are being affected along with it, so they can understand why they're having trouble walking, why they're having whatever issue it is there, and understand why something in the low back or in the liver is affecting a knee, right? You can show how that whole circuit works, and you can show improvement. It's really fun to see the lights go on in the patient's eyes when they've had an NIS treatment, especially the chiropractic patients that had some the other day. I've been telling her she needs neurologic work, and she keeps waiting for me to give it to her for free. When she finally bucked up and made an appointment because she was having lots of gallbladder issues on a ketogenic diet. And we had a nice long talk about the ketogenic diet, but then we were able to show her her liver, her gallbladder, her large intestine, her small intestine, her pancreas were all not functioning at 100% neurologically. And we were able to get all of it turned back on, so that she actually had pain in her abdomen she didn't tell me about. And then when we were done, she goes, oh my God, I can touch my abdomen and it doesn't hurt anymore. I said, you never told me it did hurt. She goes, well, I didn't think you could do anything about it. And so and she said she had never felt that good, and her neck had never felt that good, and we didn't adjust her or anything like that. And I've been in her neck for 10 years.
Yeah, that's great. Hey, what have you seen referral-wise with this work, with the NIS work?
The referrals are, I don't know exactly what that guy's doing, but you've got to go and you have to try this. I had a lady today who basically came in and said, I don't know what you're doing, but I have to have everything you do, whatever it is there. And you're getting referrals for those people that can't find anything else. Those ones that they've been searching and searching and searching, and nothing else is working. Those are the patients you get referred to, and they're the best patients because they're so grateful and they see such large changes because nothing else has really helped sustain them get better. And it's really easy. It's really easy for them to want to refer because the results are there and they see and feel the changes, and they know that you're going to show their friends and family members those changes. A couple people have even like paid for their family members to come in to try it for the first time.
Yeah, I think that says a lot right there, right? I never saw that when I was doing regular chiropractic.
No. Never in chiropractic. They basically have to pull people in kicking and screaming there.
Yeah.
But the NIS there, also the patients come back in for almost anything anymore.
Right.
It's like, well, my sinuses are clogged up, or my bowels are clogged up, or my right ankle hurts. It doesn't matter. They know you're the results guy.
Yeah.
That when they leave, changes are going to be better for them. So, and that's been very powerful with the referrals. I think they're more fun patients, and they are the kind of patients I'm looking for.
Yeah. Well, I appreciate that. I just was thinking the other day about how when I first learned NIS, how it made practice fun again, and it made it interesting. And so what would you tell other docs who might be thinking about learning this system, but they've got some hesitation about it?
Well, obviously the initial thing is like, you should totally do this. And if nothing else, for your family, for your kids, for your spouse. I mean, and Jim, I know it's been powerful for you to be able to work on your wife and some of your family members. It's really opened my eyes to that there. But with regards to practice, your confidence goes through the roof with regards to what you can work on. And you're right, it's a lot more fun because those patients that usually are like, it's a little bit better, but there's still something there. Now it's like, oh my God, I can't believe how much better it is. Oh my God, I can't believe how much better it is. And those are always the fun treatments to get to work with there. And we have them intermittently with chiropractic, but it's like every treatment with NIS. Yeah. Every patient, they go, wow, I can't believe how much I've changed that fast. And even those docs that use supplementations, imagine if the body could use those supplements at a faster rate, more efficiently. Your body can absorb the nutrition better. It enhances all of that stuff as well.
Yeah.
The hard part is letting go of some of the chiropractic stuff because you're not going to need to adjust as much.
Yeah. Yeah. Well, it's true. They say that something about you can't climb a ladder without letting go of the rung you're on, right?
Absolutely.
So,
absolutely.
So listen, I've really enjoyed getting to know you, and I really am excited about how you've embraced NIS and taken it on and made it part of your life. And it's just really, that's so gratifying to see. And I'm so happy that you're having a good experience with it, and appreciate very much your time today for sharing this with other people.
Anytime for you, Tim.
Thank you so much, Ryan.
All right. Have a great day.
Thank you. Bye-bye.
Bye-bye.